Yeah, good morning once again, ladies and gentlemen. David, as usual, it's another Tuesday, another health talk day. We thank God we've seen this day. Now, today we're going to talk about medication adherence. This is something very key because at any time, at any one point, irrespective of your position or whatever you're doing, you'll be a patient and you'll be on a treatment plan and a medication plan. So how well do you stick to that plan? So today we are going just to be very brief. We are going to define what is medication adherence. We are going to look at barriers towards medication adherence. We are also going to look at the importance of medication adherence. And then finally, we are going to look at ways of improving medication adherence. Now, what is adherence? To adhere, in a layman's language, meaning sticking to. So when it comes to medication, it is sticking to the medication plan that you are given by a doctor, or if it is for the sake of medication that you are given at the pharmacy. Statistically, it is shown that if you take all your medication, 80% of your medication, then you are considered as an adhering client. Less than 80%, you are a non-adhering client. Also, in comparison with time, it shows that half of the times that medicines are prescribed, half of the times they are not being adhered to, and that is very serious. Now, what are some of the causes of non-adherence? What makes you not to stick to the medication plan that you're given by the doctor? Number one, fear. There are people who we can call it, maybe they were given a particular medicine, then it produced a side effect and it affected them at that particular time. They come back to your facility again, they're given a similar medicine or maybe same class of that medicine. They will definitely have that fear that maybe it might produce another side effect just like the other one, or maybe they saw their relative or their parent, their sister or brother having or struggling with the side effect of that particular medicine. It will be natural for that patient not to be adherent to that particular medicine because of the fear. Number two, which is also very key, is cost. Most medicines are not very affordable. So some patients might not do their refill medication because maybe they simply can't afford that medicine. And at the end of the day, that is non-adherence because it will affect the outcome of your condition. Another thing is too many medicines. This goes to patients on long-term medication. They are hypertensive, they are also diabetic, so they have to take so many medicines, and that means that there will be a higher frequency of taking their medication. So the higher the frequency of taking the medicine, the higher the chances of non-adherence, because you have to take twice a day, others 3 times a day, others once a day. That can bring a lot of confusion to a particular patient. Another one is misunderstanding, and this one affects the healthcare provider who the patient interacted with last. Now, if you didn't tell the patient about the side effect of this particular medication that they are taking, you didn't tell them the possible outcome of that medication, you didn't tell them that they have to be continuously on that medicine for their condition to improve, that patient might go home, experience a side effect, or might go home, use that medicine and see no response and then stop taking that medication. So it is your responsibility at a healthcare center or as a service provider to be very frank to the patient, tell them everything they need to know about the medicine. Another one is what we call depression or fear or worry. We have talked about fear, worry or depression. Now, long-term patients on long-term medication, it is very natural for such a patient to fear being dependent on that medicine forever. And as they continue taking that medicine, it will definitely affect them. Some of them drop just because of that. And that is non-adherence. These patients need your support. These patients need your counseling on their medication and to make them understand that they are getting better because the medicine is in the system. Another one is mistrust. And this one is on the side of the patients. A patient might not understand why you are giving them a generic medicine and not an original medicine. A patient might think that you're giving them this particular medicine because it is short expired. A patient might think that you're giving them this particular medicine because it was advertised on the TV, so you're doing a favor. A patient might think that you're giving them that particular medicine because maybe it is the influence of med reps and all that. So there's mistrust. Also, that can affect the patient. Might go home and start saying, no, I can't use this medicine, I need another one. And that at the end of the day is considered as non-adherence. All those factors that I've talked to are called intentional barriers to medication adherence. There are some that are called unintentional barriers to medication adherence, and this include things like forgetfulness. Yeah, you wake up in the morning, you're in a hurry to rush to work, you forget to take your medicine. That happens. Number two is very fake schedules of job, frequent changes of shifts. When that happens, you might not really get time to go maybe to take your medication that maybe was slated for maybe 1 p.m. and then all of a sudden you're shifted into a 4 p.m. shift. Another one is lack of education, awareness on health issues. Yeah, some patients might have a low literacy level in terms when it comes to medication and all that. These are patients that need a lot of information. They need a lot of counseling by both the pharmacy team and the doctors and even the nurses at a facility. Another one may be an unplanned travels, journeys. You wake up in the morning and then you're called to travel somewhere because it is an emergency, and then you forget to take your medicine or carry it with you. These ones can all lead to what we call non-adherence. Now, what is the importance of medication adherence? Why are we insisting on you to stick to that plan? What I need you to understand is that your condition is good, or your pressure is normal, or your sugar levels are normal because you are on that medication. Otherwise, if you stop using that medication, those values will change. And also, some conditions are asymptomatic, as in they don't produce symptoms immediately. So some patients might take medicine, feel better, and then they drop because there's no change. Yeah, they don't feel bad when they started the medicine. They don't feel affected. There's no big change between the time they started taking their medication to the time they stopped taking that medication. But see, there's something called future outcome or adverse effect of that action that you're taking. So you should stick to your medication. So number one, why it is very important to adhere to your medication: we are trying to prevent you from frequent hospital admissions, frequent visit to the emergency rooms, frequent visit to the theater. Because when you don't take your medication, for example, if you're a hypertensive patient, or let's use a diabetic patient, you will come with an emergency low blood sugar, and you know what that means. You will be admitted for some time. So it is very important to stick to that medication just to make sure that your vitals are okay and you don't fall into that trap of frequent admissions. Number two, we are trying to reduce the cost of medication and treatment. When you don't adhere to a medicine, sometimes the doctors might decide, after monitoring and doing all the steps they need to do, to change your therapy or shift you to another medication, and that is an additional cost to you and even to the facility in the long run. So we are trying to avoid that too. Another thing is we are trying to improve the quality of your life. When you are frequently admitted to a hospital, number one, the chances of you acquiring other conditions, maybe because your immunity drops down and all that. So we are trying to improve your quality of life if we encourage you to adhere to that medication. Another thing that we are trying to do is that we are trying to improve the quality of care and your safety as a patient. When you adhere to those medications, when we tell you about the side effect of those medications, the outcome of your condition improves and your safety as a patient also improves. Another thing we are trying to reduce is the chances of you developing resistance to particular medicines. There are some medications that if you develop resistance to, then we don't know what we will do next with you. Because when you keep on taking your medicines, dropping them, taking your medicines, dropping them, your body system develops what we call tolerance, and at the end of the day, when you're given the particular medicine, your body might not really respond to that. So there's also another effect of non-adherence. So it is also our role as healthcare providers to be very open with you, to explain to you frankly, if you are a hypertensive patient or a diabetic patient, high chances you will be on those medications for a long time. So it is very key that we tell you that you will be on these medications for a long time, and your condition will improve as long as you are on the medication, and might worsen when you drop those medicines. Yeah, so it is dependent on you will depend on those medications so that your vitals become better and tolerated well. It is also very important for the patient to develop what we call a mutual rapport or a mutual relationship with the care providers. The care provider should also do the same. This enables the patient to open up to you about why they didn't take their medicine, and it also helps you to format for them what we call a fitting adherence program. Every patient has a different reason why they didn't take their medicine. So you can't use the same formula used on another patient on this particular patient. So as healthcare providers, let us be open with them, let us be frank with them, let us encourage them, let us motivate them, let us give them the information and be open to them so that they can be able to tell us why they didn't take their medicine, and then we create what we call a treatment plan with them together involved. So that is the importance of medication adherence. So how can we improve medication adherence? Number one, for unintentional medication adherences, you can, as patients, you can maybe create alarms at the time that you're supposed to take that medication. You can also have reminders on calendars. You can also create what we call treatment buddies. These are just partners that you take the same medication with, more so for long-term patients. You can always encourage each other, remind each other. So you come together, you discuss how you're feeling, how you're faring on, what you need to tell to the doctor during the next visit. That's the importance of what we call treatment buddies. Also, always be open to the care providers, and the care provider should also be open to their patients in order to improve what we call medication adherence. I hope you picked a point. I hope you learned something. Have a great day ahead, and please adhere to your medication. Thank you.